One voice can be loud, but multiple voices together with the same kind of energy really can make a lot of change happen. Prevention is our opportunity for hope. It's our opportunity to see change happen before we see some of those negative outcomes come to life. So if we could invest in trying to prevent some of the difficulties for families, for communities, when it comes to substance use or any other kind of problem behaviors, then wouldn't it be great for all of us?
Our goals are pretty simple. It's to reduce the demand for drugs and try to prevent youth from initiating that onset drug, alcohol, tobacco use, reducing that and pushing that timetable out as far as we can.
If we talk about it, we better equip young people to make more informed decisions. If they know the dangers, they can have a better chance of making better decisions. The Community Coalition Alliance has been in place since about 2008 as a chance for coalitions that were working at different counties to brainstorm, leverage their ideas, working through lessons learned, coming up with ideas on how to collaborate more.
Dixie County is a small rural community and our resources are limited. Through the Community Coalition Alliance, we're able to receive block grant dollars, which are state prevention dollars. Once you receive a grant, there's quite a few requirements. We learned how to manage a grant and how to utilize our grant funds to make sure that we reach the goals set by the grant.
Biggest footprint for CCA is the Northeast Florida region, approximately 20 different county level coalitions. I'm going out and working with these counties and they like what CCA is doing. They love the mentorship, they love the guidance.
This is what we envision for an alliance. Share ideas, talk about those barriers, come up with ways that we can overcome things and really brainstorm on how to better reach our communities.
We have a meeting every quarter and they educate us on how to address issues that we have in our communities. That way we can all get together and collaborate with other counties and communities. And some of them are having the same problem that we're having, and they talk about how they address it, and that's how we get our information on how to come back and try to address it in our communities.
We look at local data, regional data, and we also look at state data. And you're actually able to pinpoint what the issue is.
Over time, the different coalitions were able to come together and put the bylaws in place, get a board together to really be that guiding force, and so they were able to finally hire on staff. We have individuals who have a background in research, a strong background in contract management, finance management, individuals that have worked at a local coalition, who know what it's like trying to bring together all the different partners and maneuver through what local barriers and challenges are. They come with a collaboration approach. Every single one of them, even though they have a different background, they have that one trait that really makes this team so great.
Some other programs we have, Know the Law, where we teach the kids the laws so they know if they break them, then they can't get into college or the serious troubles that they get in. Compliance checks and environmental scans, teaching them to keep the stuff where the kids can't pick it up off the counter.
Prevention with a Purpose was an initiative that was started late last year to engage with youth organizations around the state to get a fresh perspective on what reasons young adults have to stay drug-free. The response was overwhelming, and the resulting video made a huge impact on Advocacy Day.
We were kind of approached by an organization called deTerra, which is a way to safely dispose of prescription medication. For Kathleen and I to kind of partner at the state level to be able to get some grant money to get deTerra for all of our local coalitions. It couldn't have come at a better time, right at the beginning of COVID. We were able to get it out and still be able to help communities safely dispose of prescription medications, which is even more important during the pandemic.
We set up 4 quarterly meetings. We have a whole day dedicated to all of the different members coming together to do training, brainstorming. Sometimes we're able to distribute resources.
We also can call them and they can just counsel us over the phone or talk to us, and they care about what we do. We're truly blessed for what we're able to do in our community because a lot of people don't have the things that we have in our little rural community.
They also are able to help us find strategies that fit our need, and that's critical. This year, the Dixie County Anti-Drug Coalition celebrates 11 years. And it is because of the Community Coalition Alliance that we've been able to do what we've been able to do. They're amazing.
For more information about CCA, we have ccafl.org. See all the different things that we're working on and doing. It'll help you to locate the local coalition of your county and what's the contact information. And we stand here for supporting community coalitions because at the end of the day, we have the same goal in mind, creating safer and healthier communities for all Floridians. Who doesn't want to get behind that?